This is Elizabeth Wheeler coming to you today from my clinic, Pittsburgh Performance Physical Therapy in Pittsburgh, Pennsylvania. I wanted to shoot a quick video kind of geared towards our healthcare workers. We've all seen you kind of in that head to toe PPE, geared up for the day. As a physical therapist, of course, I look at some of the physical stressors or demands that can be placed on the body, not only with this equipment, but just your general line of work. So this video is related to neck and back strain. And then I'm going to give you a few quick tips and also a little treatment session you can perform daily to reduce this strain. You can see in this picture a couple things I noticed right off as potential contributors to this neck and back strain are the masks. So especially those with the elastic loops, they create some additional tension behind the jaw and neck. And then also they restrict breathing, which is an issue. The other thing, those paired with the goggles, you may have noticed, and a lot of the people in the public too wearing masks, is you almost have to bend your neck and look down further to kind of see over the mask and through the eye goggles. So these further contribute to a neck strain. And then this paired along with prolonged hours or long shifts wearing this equipment creates a lot of potential for injury. So just considering these couple areas, what we're going to talk about today is how to mitigate this strain and provide some maximum relief, especially at the end of the day, to allow those muscles to recover. You've seen this picture before. This is a great picture to demonstrate the forces on the neck, especially when you move the joint in a different position. And this applies to all areas of the body. The spine is one unit, right? So everything works together. I'm not going to talk a lot about the low back, but we are going to mention the mid back and how it can affect the neck. But generally speaking, that head wants to sit directly on top and stacked on top of the spine. And this is where there's the least amount of force on all the surrounding musculature. So as soon as you go to move that position, so as you bend forward, and you can see the degrees here, that creates just an excessive amount of force that all these muscles have to produce to stabilize and support that neck. So here's the picture. You can see how many more pounds of force the muscles had to produce corresponding to the degrees of flexion of the neck. And then even worse are, some of the other equipment. So like the helmets with the shield, even if they weigh a couple pounds, you have to add that, multiply that amount of force. And this is how much more the muscles have to work. Our muscles, thankfully, have really good properties, and they have these elastic properties that allow them to kind of be deformed, be in abnormal positions, but then recover and get restored back to their original length. However, I'm going to put up the stress strain curve, which you may have seen before as well. There's going to be this breaking point where the force is too much that tissue is going to either strain or break or tear. Here's that picture of the stress strain curve. And then really what we're discussing is the creep principle, where it's a low load of force over a length of time that causes the strain. Not to mention if you take somebody, that has an, older neck with more degenerative changes, arthritis, or prior strains, they're going to reach this breaking point a lot sooner than somebody else with a healthy neck. Okay, just to recap, so the main things you want to address: head, neck and jaw tension, hyperflexion of the neck, those positions, restricted breathing, and then this prolonged positioning in a bad position. Your goal during the day is to mitigate these stressors so you don't have as much damage done, but then at the end of the day to get things back in their normal positions, and this is how we're going to do it. Okay, so this next part, I urge you to do all of this in order. You're going to have a lot more benefit if you do all of these steps. First thing though, what we need to do is get the body into a relaxed state. So I'm going to give you 3 quick ways to do that. One of them is moist heat. So the neck responds really well to heat, and there's a couple ways you can do that. I have one of these. You just throw it in the microwave. It has kind of the beans in it. 1 to 2 minutes is all you need. And if you don't have one, you can make up your own. 1 to 2 cups of rice. You can throw it in a sock and tie it off, or a pillowcase or something. That will work. You can also grab just a towel and wet that, and then you're also going to throw that in the microwave for 1 to 2 minutes, and then you have your own hot pack. The second way is we need to start relaxing the body and getting it to a better state, decreasing stimuli. So the next thing you can do is close your eyes. So all the stress throughout the day, even straining to look through the goggles. Okay, and then I want to bring in Kristen Grader. This is one of the physical therapists here. She's also a doctor of physical therapy, and she agreed to help me out today to demonstrate some of these exercises for you. First of all, with the deep breathing. So remember, with the shallow breathing, using the mask, not effective. And so we're going to do some deep breathing. So while you're doing this, what you want to do is go ahead and let the shoulders rise up to the ears. So some of these accessory muscles that help in breathing, you're going to get those stretched out, fill the lungs up. And then when you exhale, kind of purse your lips. It's almost like you're gonna blow through a straw. And you wanna blow the air all the way out. If you're doing it properly, you'll feel some of the abdominal muscles tighten, and that means you're letting the breath all the way out. This is an effective breath. You're going to do about 30 seconds of this. If you have more time, that's great too. 5 minutes would be great, but this is going to help to relax your body. So you can do the heat, close your eyes, start some deep breathing, and then the next step is we want to get some new blood circulation and blood flow to those muscles. So clean out some of the chemicals and inflammatory, pain chemicals that are there, and get some new oxygenated blood to the muscles, because then we're going to stretch later. So how you can do this is 2 different ways. One is just shoulder shrugs. So you're going to bring the shoulders up to your ears, and you're actually going to squeeze the muscles. So kind of resist yourself and really get the muscle squeezing, and then you're going to exhale and let them drop down, and do it again. So this will just create some pumping action and the muscle. The next thing you can do is shoulder rolls, and these are great throughout the day too, just to bring some circulation into the muscles. So you can go forward or backward, yep, either way. I would say like 5 times forward, 5 times backward. I'll do a set of 10 of these. That's perfect. The next thing we want to do is get the mid-back moving a little bit. So we mentioned before, right, the whole spine moves as one unit. There's good evidence that the mid-back is a contributor to neck pain oftentimes. So here's 2 quick mobilizations you can do on your own. One is seated, one is lying down, depends on where you are. So the first one, if you have a towel roll, that would be great. This is going to go along the mid-back. So you're going to place it there, and then you can also end up moving it up and down the spine. And then clasp your hands behind your neck. Elbows are going to go in close. And then as you exhale, you're going to arch back over that towel roll. That's perfect. You don't need to hold this one. You're just going to do a set of 10 reps. You can move this towel up and down. It's perfect. And then continue on. And it should feel good. Basically, you're counteracting that bent forward position that you're in all the time. The second way is the same movement, it's just lying down. If you have a yoga mat that you have rolled up, like a beach towel rolled up, or even a foam roll, all of these work great. So you'll go on your back, keep your knees bent, your feet are up, so that'll give you a little bit of support. Same position with the neck, you're going to clasp the hands behind your neck, elbows are in close. Exhale as you arch back over the roll. That's perfect. That's great. Okay, and then the next thing, what we want to do is we want to release some of the actual tissue, right? And then we're going to stretch out. One great way you can do that, I don't know if you've ever seen one of these before. If not, it probably looks very strange. But this is a great design. It has all these little nodules that you can get in some of the tissue and release some of those knots. So if you feel, you can even see or feel some of the knots or tight tissue in there, that's what we want to release a little bit before we stretch. So I'm going to give this to Kristen. What you want to do is you want to just find one of those tight spots. You can give some pressure downward, because even deep pressure will start to release some of that tight musculature. And then a couple other things you can do is you can, number 1, move the neck back and forth, kind of like there's a little bit of active release. You're looking for some decrease in pain or some increased range of motion, or just feeling like the muscle is releasing some, and then you're good to go. You can also use a tennis ball, or if you happen to have like a regular cane around that has the hook, that's perfect. So this one I just purchased on Amazon. I'm not promoting any specific brand here, but I will say that this was a few dollars more, but it was made in the USA, which is why I bought it. Okay, so now we're ready to stretch out some of these muscles. So, from being in this flexed, head forward position down, these muscles in the front start to shorten. You can see that. So we need to stretch those out. So how we're going to do this, we'll stretch this side. So you can do both. Ear goes down towards the opposite shoulder. And then you can tilt the chin up towards the ceiling. And these get these muscles that come and attach up behind the ear. You can use the opposite hand for some extra pressure if you need. It should be gentle, you should be stretching out, and you should also be breathing in and out. You're going to hold this about 15 seconds. A lot of stretching parameters are like 30 to 60 seconds. A lot of times I find the neck doesn't want to be cranked to one side for that long, so 15 is great. So you'll do 3 times on each side, 15-second hold. The last thing is now we have everything stretched out, right? We want to realign that neck and kind of stack that spine on top of each other. And so this next one is a chin tuck. All you're going to do is you're going to slide that neck straight back. And you can see as that ear starts to align with the shoulder, the back of the neck kind of opens up. So almost feel like your head is being kind of pulled up towards the ceiling. You're going to hold that for 5 seconds. and do about 10 reps in a row. This one's also great to do anytime throughout the day, just to make sure you're kind of in a good position. Okay, so just a quick recap. We want to get the body relaxed, get some new blood circulation to the muscles, get the mid-back moving a little bit because that helps the neck, release some of the tissue, stretch it back out, and then realign. Just like any body system, the best way to manage is to prevent the problem in the first place. You know, for cardiovascular health, right? That's why we have a healthy diet. We do cardiovascular exercise, so then we're not, recovering from a heart attack or something. I'm going to mention just a quick tip too. When you put on your PPE, take note of what position you're in for the most part. So if you're in a flex position, of course you want to stretch and get out of that at least some point during the day, right? But put your goggles on and your mask on, and look through and just see if that's a good position. So that will be helpful in reducing some of that strain as well. You're going to perform these techniques throughout the day to minimize the cumulative effect. And then at the end of the day, do this full routine together. And this will really help you recover and reduce injury. And I want to encourage you, not just now, but for the rest of the time you're on this planet, living the one life you have. Take everybody and be well. If not, or something happens, your physical therapy team is here for you.